We have in quarantine those infected and those at risk. We have a lot of great quarantine facilities.
The president addressing the nation as the coronavirus emergency continues overseas. The CDC now warning Americans to prepare for significant disruptions in their lives. Good evening, everybody. I'm Trisha Keene.
And I'm Ty Quinones. Congress now pressing the White House for more funding. And right here in the Valley, hospitals and the health district are also getting ready.
We have team coverage tonight on what measures are in place in the Valley to ensure this stays under control. Let's begin with 13 Action News anchor Nina Porciuncula. Nina.
We have over a dozen in free income-based clinics here in Las Vegas. Always there is a resource for them for those who are underinsured and uninsured. But in case of a coronavirus outbreak here in Las Vegas, here's what you need to know.
As coronavirus spreads across the globe, the U.S. braces for a potential outbreak. The CDC warning Americans to take coronavirus or COVID-19 seriously.
Your risk is still fairly low, but it's not a matter of if, it's a matter of when the virus becomes widespread in the United States.
Dr. Christina Madison of Roseman University of Health Sciences say most healthcare facilities in southern Nevada are prepared to handle cases of COVID-19. But since there hasn't been enough dire cases in the country yet, we don't know exactly what the fallout will be for uninsured Americans if a pandemic happens. As for what awaits if you're uninsured and you go to the doctor with COVID-19, the good news is that you most likely won't be turned away.
Doesn't matter if you're insured or uninsured, we're going to take care of you regardless. Obviously, those who are uninsured may be more concerned about seeking medical attention because of cost, but just know if you do feel sick or ill, you can always go to an urgent care or ER, and they're going to help you.
Right now, it's more important to stay informed, but not alarmed.
Similar symptoms as far as the flu, but the real big difference is those respiratory problems and shortness of breath and difficulty breathing. So anytime you have that shortness of breath, difficulty breathing, that's not something that you're going to be able to ride out. You really need to be able to seek medical attention as soon as possible, because that's when people get into trouble, and when they're hospitalized, then they end up having to go on a respirator.
So now let's go to 13 Action News reporter Jeremy Chen live from the Health District to explain who will take the lead if the virus pops up here in the Valley.